Good morning everyone and welcome to our presentation. Today, we are going to explore an important topic in clinical parasitology. Our focus will be on Entamoeba coli, an organism that plays a significant role in diagnostic medicine. Before we begin, let us introduce ourselves. My name is Fauzana binti Jesni.
And my name is Nurfitriah binti Saiful Anuar, and we both are students from Diploma in Medical Laboratory Technology. We are so excited to guide you to go through to this topic today.
To start off, what exactly is Entamoeba coli? Often abbreviated as E. coli, not to be confused with the bacteria Escherichia coli. This organism is a non-pathogenic intestinal protozoa. This means that under normal circumstances, it lives in the large intestine of humans without causing any tissue damage or disease. However, it is highly significant in a clinical setting because it spreads through food and water contaminated with fecal matter. It's present in a patient sample, serves as a crucial bioindicator. It tells us that there is poor sanitation, inadequate personal hygiene, or a potential exposure to true pathogens.
Let's take a look at where this organism fits biologically. Looking at its scientific classification, Entamoeba coli belongs to the kingdom Protista and the phylum Amoebozoa. Moving down the hierarchy, its genus is Entamoeba and its specific species name is Entamoeba coli. As an amoeba, this organism possesses distinct biological features. First, it is entirely non-pathogenic. To move and capture nutrients within the large intestine, it extends temporary cytoplasmic injections called pseudopodia or false feet. It reproduces simple and efficiently through binary fission. Throughout its existence, it transitions between two primary stages, the active trophozoite stage and the dormancy stage. A key defining characteristic to remember is that its mature cysts contain exactly 8 nuclei.
Understanding morphology is essential for laboratory identification. Let's break down the true life stage. The trophozoite. This is the active feeding stage. It measures roughly 15 to 50 nanometers in size and has a irregular, ever-changing shape. If you observe it live, you will notice its movement is quietly sluggish and slow. It contains just a single nucleus. The seeds. This is the survival and infective stage. It is distinctly round. Enclosing is a protective thick wall and, as mentioned, a fully mature site housing 8 nuclei. This structural resilience allows it to survive outside the human host.
The life cycle of Entamoeba coli is straightforward and does not require an intermediate host. It begins when mature infectious cysts are passed out in the feces of an infected individual. If these cysts find their way into food or water sources due to poor sanitation, they are consumed by a new host. Once the cysts safely pass through the stomach acid and enter the small intestine, excitation occurs, releasing the active trophozoites. These trophozoites migrate to the large intestines where they live, feed and multiply via binary fission. Eventually, as they move down by the colon, they undergo excitation to form new cysts which are then excreted, repeating the cycle.
How does it spread? The primary mode of transmission is via the fecal oral route. This most transmission happens when individuals consume contaminated food or water. It is heavily exacerbated by poor personal hygiene, such as failing to wash hands after using the toilet, and inadequate public sanitation infrastructure.
Now, let's talk about our role in the laboratory. Firstly, diagnosis. We identify entamoeba coli through a routine stool examination. Under the microscope, we utilize three main preparation techniques: standard wet mounts, iodine stain, and trichrome stain. To differentiate it from pathogenic amoebas like Entamoeba histolica, we look for two specific diagnostic clues. First, the presence of mature cysts containing a nuclei and a nucleus with an eccentric chirosome, which meaning the central chromatin mass is off-center.
Because transmission relies heavily in environmental factors, prevention is simple but highly effective. We can stop the spread by practicing proper hand washing by soap, ensure access to clean, boiler or treated drinking water, maintaining strict public sanitation, and thoroughly washing all fruits and vegetables before consumption. To conclude, while Entamoeba coli itself is a harmless, non-pathogenic protozoa, its presence in a clinical specimen is a major red flag for future contamination and poor hygiene.
By thoroughly mastering its morphology and life cycle, we as medical laboratory professionals can deliver accurate diagnosis, raising public health awareness and promoting better sanitation practices. Thank you so much for your attention and time. We are now open to any questions you may have.